Good evening and welcome to our live event tonight. It is 8 p.m. UK time, so therefore it is time to start our webinar. And I'm very happy to be back here. And we do have another guest today, so please let me know that you can hear me loud and clear. And as always, I am Caroline, your host, and I am today here with Dr. Maria Arque. Hi, Dr. Maria, how are you feeling tonight?
Hi, Caroline. How are you? I'm very well. I'm happy to be here as usual.
Exactly. This is another webinar with Dr. Maria. So we are definitely excited that you have decided to join once more our Stronger Together initiative. This is like a second edition. Some of you probably already seen that we are going again with the second edition of Stronger Together. This time we want to support all the patients that had any failed attempt. But of course, there are other topics in here as well that we will discuss. So today, we definitely have a topic that has been more and more frequently asked about. So it is, of course, IVF pregnancy guarantee. And Dr. Maria today will be discussing this. So, of course, she will start with her presentation. And after that, it will be time for your questions. So all you need to do is simply put the questions in the chat section. And after the presentation, Dr. Maria will answer them for you as always, so don't miss that chance to ask any questions you have in mind. And before we start with the presentation, let me just remind you that, of course, the Stronger Together initiative, all the events have been brought to you thanks to our ambassadors and partners. Of course, as always, without their help, it would be very, very difficult to put so many of those events and give you this opportunity to find out on various topics when it comes to IVF. So I guess this will be it from me. We can start with the presentation. Dr. Maria, ready?
Ready.
Excellent. So let's go with the presentation. Thank you.
Perfect. Thank you, Caroline, for the kind introduction. As Caroline has already mentioned, I am Maria. I'm Dr. Arque, the Medical Director at Work International. And tonight, the topic of our presentation is IVF pregnancy warranty refund-based programs in Europe, costs, restrictions, and qualification. So, what are IVF refund or IVF money warranty programs? So basically these programs, the IVF refund programs, that's the term that we use for the financial IVF programs. And usually in these programs, what happens is that they give patients to access to 2 or 3 IVF cycles for a single payment. Usually these include the fresh embryo transfer and frozen extra embryo transfers are included in the price. And the cost of an IVF refund program in Europe ranges from 10,000 to 20,000, depending on the type of program and the country where it's done. A multi-cycle IVF refund program means that the treatment continues until the desired result. It may refer to either clinical pregnancy rate or live birth rate, or until the program cycles are completed. And if the IVF program ends successfully, the clinic will not return you the money that you've invested in the treatment. However, if you don't achieve your goal, you can count on a partial or a full refund of the costs, depending on which is the agreement with the clinic in that sense. So basically, in general, the cost of an average IVF warranty program in Europe is around 17,000. It usually includes around 3 cycles. The success rates expected are between 85 and 99%, and usually most of those baby warranty programs include the visits, an ICSI, blastocyst culture, embryo freezing, frozen embryo transfer as well. Some of those refund programs have some restrictions in terms of medical conditions and some criteria that the couple or that the patient that goes to undergo under the baby warranty program has to fulfill. We're going to go with more detail about this a little bit later on. And then the expected outcome can be either a pregnancy or either a 12-week pregnancy or either a live birth. That also depends on the warranty program. And amount refunded, usually most of the cases would be 100%, but again, it depends on the baby warranty program that you choose. So what is exactly warranted in those programs? So programs with a warranty are becoming more common, and the terms and conditions attached to these programs sometimes can be a little bit complicated and sometimes confusing. Obviously, as you all know, unfortunately, in medicine, there are no certainties or warranties. So the only warranties that we're talking about when we're talking about baby warranty programs here are financial. That means that if the result of the treatment is not the one that was expected, the money invested on the treatment would be refunded. There are different types of IVF refunding programs. There is the IVF warranty. This name is a little bit misleading and probably should not be used because sometimes it is not clear. There's the IVF refund, there's the IVF money back warranty, and there's the IVF shared risk or shared IVF success programs. So why are those programs increasing in popularity? So there are many reasons why these programs are becoming more popular, and these reasons include, on one hand, the possibility of having a detailed treatment cost planning on the part of the patient. And the other thing is that the possibility of having a warranty of receiving a full or partial refund in the case of failure. Both are obviously valid reasons to consider an IVF refund program, and we have to bear in mind that one of the most important things to consider when couples are undergoing fertility treatments is that the economical burden of having to undergo to several fertility treatments, a lot of times it's a major cause of stress, and also a major cause why some couples have to stop doing fertility treatments. So having the peace of mind that there is kind of a closed price for the treatment that you're undergoing, and if that does not work, you will have a full refund, helps a lot of patients to manage this. So, which are the types of IVF refund or money back warranty programs? So basically, those can be divided into programs which aim to achieve a clinical pregnancy, and usually defined as reaching the 6, 7, or 12-week pregnancy. It depends. There are programs that the main goal is to have a live birth of a child. There's IVF refund programs in which the patient does not receive a refund if the treatment is successful, and in IVF refund programs, the patient receives a partial refund if the treatment is successful. And also, it is important to note that refund programs for IVF are available both for the treatment using egg donor and own eggs as well. Again, here there are some age limitations. For example, for patients who want to try to do a baby warranty program with doing an IVF cycle with their own eggs, probably the maximum age in which they would be accepted in a baby warranty program would be at the age of 39. And probably if the treatment is not successful, the refund would be partial. Is the IVF refund program for me? So remember that no matter what the program offers and whatever it's called, but what the clinic actually offers is a refund warranty in case that the treatment does not conclude as expected with satisfactory results. So should you then undergo a baby warranty program? As I mentioned before, finances are one of the most important aspects for most patients who undergo an IVF treatment, and it's something to consider in the case that you can afford it and you want to have that peace of mind of having a refund of the money if the outcome is not what you were expecting. Because sometimes it is true that it takes several cycles to end up having a good outcome, and in that case, sometimes in those cases, the overall cost of the treatment ends up being more expensive than the refund. On the other hand, in patients who have very good prognosis or that we end up having the outcome that we were expecting from the very beginning with the first cycle, those patients, if they undergo a baby warranty program, they would end up paying more money than would have been necessary for only one whole cycle. So what would be the pros of undergoing an IVF refund program? The first pro would be a full or partial refund in case of an unsuccessful IVF treatment, which can be put towards further treatments. The clinic is obviously motivated to achieve a success as quickly as possible. After all, a money refund is on the line. If you all use all of the IVF cycles within the program, the overall cost becomes cheaper than if you were receiving the same number of cycles outside of the program. And as I was just mentioning, sometimes the IVF warranty options turned out to be cheaper. And you can also focus on your treatment instead of finances, which it's also a major concern for patients. And every cycle assigned to your program will be performed at the same clinic. That's something that happens often, that patients, when they have an unsuccessful outcome, they switch clinics, just aiming or hoping that they will have a better outcome somewhere else. Even though it's completely normal, it is not always the best choice, because sometimes sticking to the same clinic can help to have better results, because obviously this team will have a little bit more insight about your medical history and will know your case a little bit better. And then also it gives us the option of doing financial planning of your treatment easier, and since it's easier to estimate also the total cost of the program. What would be the cons of undergoing an IVF refund program? So basically, if you achieve your desired result during the first cycle, as I said before, you would end up paying more than what you could pay only for a single cycle. And not every patient qualifies for an IVF refund program when it comes to treatments using donor eggs. The qualifications for the patients are relatively lax. But if you're set on using your own eggs, it becomes much harder to qualify, as the financial risk for the clinic becomes higher. And as I said, age would be one of the main limitations, but also probably ovarian reserve criteria, like there would be a cutoff for your AMH, for your antral follicular count, and some other criteria as well. And it is the other con is that it is the entry cost for such programs is higher than for undergoing a normal cycle of IVF. So what about the qualification of those programs? So patients who are considering to sign up for an IVF refund program will need to pass some medical tests in order to qualify for the treatment. Couples, for example, in which men might have low sperm quality might be disqualified for some of these programs, or they might be requested to undergo some other fertility tests to confirm that that would not have a detrimental effect on the final outcome of the cycle. There are different clinics with different criteria for judging the sperm quality. Some of them use like the latest World Health Organization directives, while others have their own standards dictated by their own experience. Some clinics also require the karyotype test, which, depending on the country, it's not cheap. As it is a genetic test and it doesn't change a long time, it is not necessary to repeat it at all in your life afterwards, because that result will remain the same forever. That's also a question that we get very often, is that patients' age and BMI a factor when qualifying for an IVF refund program. As I said before, in case that we're using IVF treatment with a donor, usually age doesn't play an important role in terms of likelihood of success. But it is true that there is kind of an agreement in between clinics and some kind of legislative and statutory guidelines that limit treatment based on patient's age. In Spain, we don't treat patients who are over 50. Okay, that's the limit of age that we have. In case of using your own eggs, there will be different baby warranty programs that will mainly also depend on your age, and as I said, also on other factors like your ovarian reserve. Sometimes, depending on your age and your ovarian reserve, that might mean that you might be accepted for a different baby warranty program that might leads to having a refund of the 50% of the money that you have invested on the treatment instead of the 100%. And then another important requirement for IVF baby warranty programs is having an appropriate BMI, and most clinics for donor-egg programs accept a BMI of maximum 35. Okay, in cases of higher BMI, probably the clinic will recommend performing additional tests or might not accept the patient for the baby warranty program. So some of the tests that will probably be required for undergoing a donor-egg IVF program in a clinic in Spain would be hormone tests, a scan to check that the endometrium is completely normal, that there are no fibroids, no polyps, nothing that can jeopardize or diminish the likelihood of an embryo implanting. For the male partner, we would be doing semen analysis and karyotype, and depending on the clinic, they may also ask for other tests like FISH test or DNA fragmentation or other tests. And as mentioned before, the maximum patient age is 50, okay, in Spain. While in most cases all those tests are not included, and usually are not free of charge. Sorry, in most of the cases, those are deducted of the final price of the treatment. So which are the costs of an IVF refund program? So the total cost of an IVF refund warranty program can range from 10,000 to 25,000 in Europe. When we compare that to a treatment of just one single cycle of egg donation, obviously that doesn't look affordable. It looks much more expensive. But obviously, what does that include? That includes that we have to take in consideration which type of treatment we're doing. If we're doing IVF using your own eggs or an egg donor, the desired result, clinical pregnancy or live birth. Programs aim to achieve a live birth are usually more expensive than the ones that guarantee a pregnancy. Because obviously, if you get a pregnancy in the first trimester of the pregnancy, unfortunately, there are still risks that you can end up having a miscarriage and that there is no baby born after that. And then the number of cycles included also determines the price, and the number of frozen embryo transfers, and if they are included in the program, and additional IVF lab techniques that if they are covered by the program or not. And additionally, the IVF refund program cost is affected by the same elements that dictate the price of one IVF treatment. So this includes the number of eggs received from the donor, or any additional procedures that need to be done in the lab, such as ICSI, blastocyst, and clinics offer such programs, often including additional services and procedures. Okay, for example, in most IVF baby warranty programs, PGT is not included. The cost of medications for patients is sometimes not included in the program, and other times it is included. These medications, usually when we're speaking about a cycle of egg donation for a regular endometrial preparation, and the cost it's around 400 euros, more or less, depending on the country. And other additional costs would occur if you use donor sperm, for example. That might increase the cost between 1,200 and 1,500 on average. And as I said, PGT is usually not included in those programs. And so it is important that if you're considering to join for a baby warranty program in a clinic, that you ask these kind of things, as if PGT is included, which kind of warranty they are giving you in the sense of live birth rate or only a pregnancy, and also how many cycles are included, if all the frozen embryo transfers are included as well, if they include the medication, basically all this. And the total cost of an IVF refund program is also influenced by the country. Okay, there are the treatments usually are a little bit higher, a little bit more, more expensive in Spain than in Greek or Czech Republic or Ukraine. but also because the cost of the treatment in Spain are a little bit higher than in those countries. And these kind of baby warranty programs, for example, in Spain are much cheaper than what they are in the UK or in the US. And that's the main reason why we have a lot of patients coming from other countries to do baby warranty programs in Spain. In most cases, the IVF refund programs are often offered by external companies which work directly with the IVF clinic, and that external company is the one that offers the financing for IVF costs, while the clinic is the one that provides the treatment. You can be assured that the companies providing patients with fertility treatment financing are sufficiently experienced and enjoy a solid reputation. And what I would always recommend is whenever you are about to join a baby warranty program, you always check that company and check a little bit of the background of that company and see if they are solid, if they have good reputation, and if they have experience on doing all this. And usually once you make the payment to the external company, no further payments are needed to be made at the clinic itself. So these are examples of the different prices on average for IVF cycles for baby warranty programs using a donor. As I was saying, they range from 12,000 to 18,000 in Europe in general, except for the UK, that it's a little bit more expensive than this. So who pays for the IVF refund program? So if we take a closer look at the financial model upon which donor programs with money-back warranties are based, we may come to a conclusion that it's like a shared risk solution. This means that in practice, the patient who quickly achieves success in the treatment finance the treatment of those who need more time. They also cover the risk of the clinic offering such treatment, and this is exactly how any shared risk program works, and it's acceptable as long as the patient, so you, are completely and fully informed of the process. In our clinic, we offer baby warranty programs at Ferti, and we partner with IVF Redia, with Dimitris Kavakas, who are the ones who are the financial company who finance these treatments for patients. Dimitris has already done a webinar about baby warranty programs, also with Indonesian friends and IVF answers, so you can also find the information there. And if there is any question that I might not be able or I might not know how to address regarding all the financial perspective of the treatment, he will be more than happy to address that. But hopefully I will be able to help you with any doubts and questions that you might have today. And I hope that you found all the information useful, and I will be pleased to address any queries that the audience may have. Thank you for listening.
Thank you so much for yet another thorough presentation, and of course all the details you have provided.
Sorry, Caroline, I don't hear you.
Okay, please let us know if anyone else can hear me. Just a second, let me double check it.
I'm so sorry, Caroline, I don't hear anything that you're saying. I think that the volume of your microphone is very low.
Let me double check. I hope now it's better. Can you hear me now?
I don't know if the people from the audience can maybe write down if they are able to hear you or not, or maybe it's a problem with my computer.
Let's wait and see.
Okay, so I think that it's something with your computer, Caroline.
Okay, so apologies. Okay, let me show you.
Now it's getting better.
Okay, so let me double check. I believe
Now
it
it's
might be.
Now I
Okay.
hear you. Yeah.
Okay, good. Thank you. Thank you so much.
Sorry, Caroline.
It's definitely okay. Those things can happen. Let me go to the very first question, okay? And in the meantime, I will definitely double check if I can fix this. And of course, we do have a first question. ready. I've heard that if someone had failed cycles, they might not be accepted for guarantee program. Is there a limit? And if it was egg donation?
Hello, Kat. Yeah, this is true. Probably if you're considering doing an egg donation baby warranty program and you have had several cycles that did not work, that also depends on the cause that the clinic will have to analyze which is the cause why this treatment didn't work for you before, but that might make it a little bit more difficult for you to be accepted on a baby warranty program. Usually the limit of cycles is if you have had more than 2 or 3 egg donation cycles. If it's more than 3 egg donation cycles that did not work, most likely, unless the cause is very clear and it's already solved or there is a way to solve it, that might be a difficulty to be accepted in a baby warranty program.
All right, understood. I hope now it's a bit better and you can hear me.
Yeah, we hear you well now.
Perfect. Thank you so much. And apologies, as I mentioned, these things can happen, but I'm glad that you can now hear me. Thank you so much for the very first question. And of course, thank you, Dr. Maria, for answering this question. And of course, there are more of those questions coming up. So let's have a look at the next one right here. What if you have a successful live birth and have a number of embryos left? Are any other transfers covered or just the original transfer is covered?
That's a very good question, Sanjita. From my understanding, I'm not certain about this, so I will double check this answer. Usually, everything is covered until you have a live birth. So, if you have a live birth and then you still have embryos frozen, most likely you will have to pay for the frozen embryo transfer after you have had live birth, because you have already fulfilled what was guaranteed in the program, that it's one live birth. Does that make sense? Hello? Perfect.
Yes, can you hear me?
Yeah.
Okay, I'm right here. So, of course, as you can see, Sanjita has agreed, of course, so thanks for that. And, well, let's have a look at the next question that we have. Do you provide pictures and profiles for donors?
So, explanation in Spain is anonymous, which means that we cannot provide any information that might disclose the identity of the donor. So we do not provide pictures, neither from when they were children, neither from now, and neither we provide profiles of egg donors. The information that you're entitled to have when you're undergoing an egg donation program in Spain is the age of the donor, the blood group, and then general phenotype characteristics like color of hair, color of skin, color of eyes, height, weight, all this general information regarding the phenotype, but nothing, as I'm saying, nothing that could disclose the identity of the donor.
And thank you so much for the clarification to this question indeed as well. And thank you for your question. And let me go to the next question. What is the required minimum endometrium for the guaranteed program?
In general, there is no required minimum endometrium, but it is true that when we're seeking for having the optimal endometrium, in most of the textbooks about reproductive medicine, you will find that at least the endometrium will be 7 millimeters thick and triple pattern. That's what we will be aiming for. In someone who has a very long history of recurrent implantation failure or having had problems with the endometrium, that's something that it's going to be assessed by the team who assesses if you are eligible or not for the baby warranty program. So in general, if your endometriums are much thinner and there is a problem of what we call refractory endometrium, that means that the endometrium doesn't grow properly even though we change the medications. It will depend on the clinic. That might be a limitation or a reason why you might not be accepted for the baby warranty program.
Yes, all right. Thank you so much, Dr. Maria. The only thing is that the sound was breaking, actually. Could you just double check and switch off the camera for a second and then turn it on again just to see if it's going to refresh and see if it's going to work? Okay. Let's try, okay? I hope now it will be better. If not, please just switch off the camera, because I see that some people are simply stating that the sound was breaking. So I just want to make sure that everyone can hear Dr. Maria.
Mm-hmm.
Okay, let's try without the video for now, okay?
Okay.
Yeah, let's see if that's going to solve this. I hope so. We want to make sure that everyone can hear loud and clear. Okay, let's go to the next question. And so here it is. Is it possible to have more than one embryo transferred? Is this covered by overall cost?
Yes, it is possible to have more than one embryo transferred, even though generally in most fertility clinics, what we tend to do is single embryo transfer, because usually as much as we want to have patients get pregnant, for us it's as important, even more, that we have a healthy pregnancy and a healthy baby. And we know that twin pregnancies are much more risky than singleton pregnancies. So that's the main reason why we recommend to transfer only one embryo at a time. But most likely, if you don't have any medical contraindications for having double embryo transfer or having twins, that should be okay, and this will be covered by the overall cost.
And again, thank you so much for the question and of course your help with that. It was a bit better, the sound, I mean. It's still a little bit breaking. So if you could double check if you have any other Wi-Fi turned on, just in case, but it was definitely better, okay? So let's try.
I have everything switched off, so...
Okay. So I mean, please let us know, but of course there are some problems with the sound. It is breaking a bit, but please let us know that you are still able to hear. And just give me a second, I'm just checking. Okay, so Dr. Maria, so as we didn't hear the previous question very clearly, let me show the question once again. If you could repeat what you have said about that, okay? This is the question. What is the required minimum endometrium for the guaranteed program?
Yeah, generally what we would be aiming for, it's an endometrium that it's 7 millimeters and that it's triple pattern. So that would be the ideal, okay, that at least we have this. It is true that patients that have problems with the endometrium or have history of recurrent implantation failures, cycles that did not work, or endometrium that did not respond to the medication, and it's what we call a refractory endometrium, that might be a reason why a patient might not be accepted on a baby warranty program, depending on the clinic and depending on the cost, unless there is a solution found to try to solve that problem. I don't know if you heard me well now.
Yes, it was much better, of course. Thank you so much. So thank you for answering the question once again, of course. And well, apologies everyone for those problems, but sometimes it is out of our hands. But I believe now you can hear Dr. Maria quite well, so we can continue. And there's another question, if you could take a look. Someone with problems with uteruses, fibroids, are they allowed in the program?
That really depends. It has to be evaluated which kind of problems are there in the uterus and which kind of cyst and fibroids. Obviously, if there are problems like this, these problems will need to be solved before undergoing the cycle. For example, if there are fibroids that are in the inner part of the uterus and that can interfere with the implantation of the embryo, this will need to be addressed by hysteroscopy and removal of those fibroids through the hysteroscopy or with a laparoscopy and myomectomy. Okay, so this is something to take in consideration. And after solving those problems, the patient might be accepted on the baby warranty program. But regardless of the fact if you do a baby warranty program or not, these things need to be addressed before you have an embryo transfer, if that's the case.
And once again, thank you so much for your question and, of course, for your answer to that. And someone is typing, so let's give it a minute and check next question. But of course, in the meantime, I just want to show you that, of course, there are. Thank you for the previous answer to the previous question. So thanks for that. And let's wait a bit. Again, someone is typing, so I just want to make sure. And let me just have a look if we have it here. Yep, just a second. Let me select that. Here it is. Would the IVF clinics normally help with any potential underlying conditions, example, recurrent miscarriages?
Absolutely, the clinics always want to help with any potential underlying conditions, but it has to be. It is very difficult to answer all these questions regarding if someone with these general problems would be accepted on a baby warranty program, because someone with recurrent miscarriages can have a lot of different problems, or might a lot of different reasons why this person is having recurrent miscarriages. Having said that, once we identify the cause and we decide which is the best treatment option, for example, if someone is having recurrent miscarriages because there is a problem with the quality of the embryos, because there is a low egg quality, because of age or because of any other reason, and this patient decides that it's okay to undergo the treatment with the eggs of an egg donor, in that case, most likely there would be no problem at all for that patient to be accepted on the baby warranty program. But if we're speaking about someone who has had recurrent miscarriages with eggs of an egg donor, and that the factors might be other reasons, we're speaking about a completely different scenario and situation.
Understood, of course, perfectly. Thank you once again for your question and your answer to that one as well. Another question is a bit different, okay, but I guess we can go ahead with it, of course, as well. I would like to know about the embryo donation.
Perfect. So, Silviana, what I would recommend you is that you contact the clinic and you can schedule an initial online free consultation with me, and we can discuss that in detail. Just basically because it's not the topic of the presentation today, I think that it would be better that I can explain you that on a private consultation.
And excellent, of course. Thank you so much. And just so you know, let me just send you the link, which you can also use. And that way, there's an option to contact the clinic directly. And as Dr. Maria said, it's possible to schedule an online consultation with her. So you will be able to find all about the embryo donation. Hope that helps as well. Thank you so much. All right. And let's have a look at the next question right here. Do you ship frozen donor eggs to Canada, or the treatment has to be done in Spain?
We don't ship frozen donor eggs to Canada. What we can ship, if that was the case, is embryos. So if you want to undergo the treatment in our clinic, and then you're living in Canada and you want to do the embryo transfer in your clinic in Canada, if we have a service legal agreement with the clinic there and with their lab, we can, once we have your embryos, we can ship those embryos to the clinic in Canada. But we cannot ship only the eggs from the donor here.
Of course, understood. Thank you as well for that. And there's a thank you from Mariam as well. And well, there is also thank you from Silvana. So glad that we were able to help with that as well. And again, someone is typing, so I definitely want to see if this is another question. So again, let's give it a minute. And I guess the sound is now okay. If you would like, Dr. Maria, we can turn the camera on and see if it's going to be okay. We can try it. I mean, we will see. Okay,
Yeah,
if the sound is not perfect, then of course we can switch it off, but it's always better, I guess, right? Okay, another question is up right here as well. Where you nominate to have an egg donor and the remaining embryos that are remaining, do you offer to freeze these to be used by a client at a later date?
absolutely. We always do that. If we undergo a cycle with the eggs of an egg donor and we get several good quality embryos, what we're going to do, as we are obviously not capable of having several kids at the same time, what we will do is transfer the best embryo, and then the remaining surplus good quality embryos would be frozen and left in storage for your future use, as long as you want to use them before you reach the legal age in which we can treat patients in Spain, which is 50 years old.
And excellent. Thank you so much for your question and, of course, your assistance with it as well. And there's another thank you. So let me just go to this one as well, as someone again is typing. And this is the thank you, Doctor, for answering our questions.
You're very welcome, guys.
And there's one more thank
Please
you.
do help.
Excellent. All right. So at least at this point, we do not have any questions. So if you have any, this is like the final call for them. So go ahead and type those in. If not, we will be finishing for today. But thank you already for joining us tonight. And once more, apologies for the inconvenience. So there were some problems with my sound, then with Dr. Maria's sound, but overall, everything is okay. And I believe you can hear us loud and clear. And of course, let us know if you do have any questions. If not, as I mentioned, we will be finishing for tonight. But also, in the meantime, let me again remind you that, of course, this has been recorded. It will be uploaded on our website tomorrow as well. So if you would like to see the presentation again and hear the answers from Dr. Maria, of course, that will be possible. And once more, let me remind everyone that, of course, you can always contact Dr. Maria and her team with this link that I have just sent to you. And that way, as you know, she will be more than happy to schedule a consultation with you. And I'm sure she'll be more than happy to help you out even more. Right, Dr. Maria?
Exactly. So thank you so much for listening and attending the webinar. If anyone would like to undergo a free online consultation to assess specifically their case, I will be more than happy to see you at 30. And I just hope that you found all the information that we gave you with the webinar useful. And I wish you all a successful fertility journey.
Couldn't agree more. Nothing else to add, really. Someone is typing, so just want to make sure if it's a thank you or perhaps a question. So let's give it a minute. But of course, we are finishing slowly. Let's see. Don't want to leave without making sure that we do have a question or not. Okay. Thank you so much for that comment. We are more than happy to be able to help you out. And well, thank you. I am glad to have discovered my IVF ancestors. We are definitely happy that you've decided to join us today. And well, there are more thank yous coming up. Thank you. Thank you. Thank you.
Thank you, guys.
Thank you. And so once again, let me just remind you that we will be back here tomorrow at 8 p.m. UK time with another topic. So don't miss that chance and go ahead and subscribe to our YouTube channel. That way you will be notified when the video is uploaded. So tomorrow you will receive the notification that this webinar has been uploaded. But also if you follow us on our if you go to our Facebook or Instagram, that way you will be up to date with all the upcoming events. And as you know, there are plenty more coming up. So just go ahead and visit our sites. Thank you so much, everyone. Dr. Maria, it's always great to have you back with us. And well, I know we do have more of those events coming up. So I'm very happy that we will have you back. So thank you once again. Have a lovely and relaxing evening as well. And well, I hope to see you tomorrow here as well. Thank you.
Caroline, thank you for being a great host as always. Bye-bye.
I am always happy to be here, for sure. Thank you so much. Bye.
Bye.